Welcome to Birchwood Animal Hospital. Your pet has been booked for a surgical procedure, and we would like to take a few minutes to help you understand the procedure a little better and show you what we do to make sure your pet is comfortable and safe. Let's start with the night before. Please do not feed your pet anything after about 8 p.m., but you can leave water out overnight. Just pick it up in the morning when you get up. And no breakfast, please. But if your pet needs to take medication that morning with a very small amount of food, that's okay. Unless you have been instructed otherwise, please be at the hospital between 7 and 8:30 a.m. At that time, a receptionist or nurse will go through the planned procedure and the estimate with you and answer any questions you might have. As soon as your pet is admitted, a trained nurse will take vital signs and, if required by the doctor or requested by you, draw blood for a pre-anesthetic safety check. Any concerns are immediately brought to the doctor's attention. Then your pet will be given a gentle sedative that will ensure they are relaxed and free of anxiety while they are with us. This sedative also includes a highly effective and very safe pain reliever. When it is time for the procedure, an intravenous catheter will be placed if this has been requested or is required. This permits instant access to a vein for any needed injections, and it allows us to administer fluids that support blood pressure and improve safety. Then your pet will be given an injection that gently and quickly anesthetizes them. As soon as their jaw muscles are relaxed, a tube is placed in the windpipe that allows direct and accurate administration of oxygen mixed with anesthetic gas. We use the very safest gas, exactly like what you would have if you needed a general anesthetic. All this time and all through the procedure, a trained nurse will monitor anesthetic levels, heart rate, breathing, blood pressure, blood oxygen levels, and temperature. Safety is our #1 priority. When your pet is fully asleep, it's time to prepare for the surgery itself. To begin with, the nurse will carefully shave the area that we will be operating on. Then the pet is moved into the operating room. There, the shaved surgical area will be thoroughly scrubbed with an antiseptic soap. While this is going on, the doctor is scrubbing her arms and hands in a similar way. Prevention of infection is very important. When the doctor and patient are ready, the doctor will put on a sterile gown and gloves. She then opens the surgical pack and covers the patient with sterile drapes, exposing only the area that is being operated on. Surgeries vary quite a bit in length, from just a few minutes for a cat neuter to a couple of hours or more, for example, to conduct a major bowel repair. Regardless of how long, though, your pet is carefully monitored throughout using the most up-to-date equipment and training. During the recovery period, your pet is still closely monitored and kept warm and comfortable. Additional pain medications can be given as needed, and any pet that seems worried or disoriented on waking up is given extra attention and reassurance. You can expect a phone call around this time to let you know that everything has gone well and to set up a pickup time. Most surgical patients can go home on the same day, although there are some exceptions. For spays and neuters, you will not have to come back to have the stitches removed, as buried self-dissolving ones have been used. For lump removals and some other surgeries, there may be stitches to take out in 10 to 14 days. When you pick up your pet, you will be met by the nurse who will go over the home care instructions, including advice on how to prevent your pet from licking the incision, when to feed, etc. At that time, she will also answer any questions you might have. Surgery is an important event in your pet's life, and we are dedicated to making it as safe, comfortable, and stress-free as possible.